My name is Savannah and this is Janelle, and we are going to talk to you about the sweet truth. Did you know that the average American drinks 45 gallons of soda per year? Not only does that negatively affect your oral health, but it is terrible for your teeth. All soda are cariogenic. Cariogenic means that it contains harmful acids such as carbonic acid, phosphoric acid, and citric acid. These acids in turn mix with the bacteria in your mouth and cause decay, or also known as cavities. In this study, we found the harmful effects of soda and acid, and these are demonstrations of how much sugar is in a cariogenic beverage and how much acid is in a cariogenic beverage.
So the reason that we picked this topic is because cariogenic beverages have a negative effect on your oral cavity, which is that they produce decay. So we wanted to give people the knowledge to enjoy their favorite drinks without causing damage to their teeth. The ways that we did this was by giving them healthier alternatives such as unsweet tea, black coffee, or water. And we also recommended that they use alternative sweeteners such as xylitol and stevia.
There are many different sweeteners that have many very different effects on the oral cavity. Although sugar itself does not cause cavities, there must be acid involved. Cari microbes are housed in plaque biofilm. Cari microbes are classified as acidogenic. The slimy portion of the biofilm are mucopolysaccharides, which provide protection for the dynamic microbe community. Some artificial sugars do not negatively affect the oral cavity, such as xylitol, because of its makeup. Xylitol is good because it is non-cavity causing.
We did 4 case studies during our research. So the first case study we looked at was how xylitol can prevent caries by inhibiting the process. So the results of this study were that xylitol needs more research done about it, but that it can be used to prevent decay in any patient. Our second case study was a group of scientists studied a 25-year-old man who drank cariogenic beverages all day long, and the results of this study were that cariogenic beverages cause demineralization and decay, also enamel erosion. This is an example of the decalcification. So our third case study was about children in low fluoride areas and their sugar consumption and plaque accumulation. So the results of this study were that low fluoride exposure and sugar consumption can both cause decay, but when done together, the outcome is exponential. Our last case study was done by the Department of Cardiology and Dentistry. They studied the saliva of 23 patients, and they found that caffeine produces the same effect as a drug addiction to make people drink more cariogenic beverages. So the results of this study was that the etiology of caries is poor oral hygiene, excessive soft drink consumption, and then the treatment for this was patient ed, and then it ended with using fluoride toothpaste twice a day.
In conclusion, some artificial sweeteners are better than others for the oral cavity. You could also swish in between your drinking if you're sipping with water. You could also use a mouth rinse, which for example could be ACT, anti-cavity, or you could brush your teeth twice a day, once or twice a day would be preferred, with Crest Pro Health.
And here's our references.